So welcome along to another edition of Isolation Interviews for Hospital Radio and my YouTube channel. And I'm very excited that my guest is a super busy man, but he has, given up his time. It is, of course, Dr. Hilary Jones. Thank you for joining me, Dr. Hilary.
My pleasure, Matthew. Nice to talk to you.
Now, it was about this time last year that we both met up and we recorded a Take 5 show, which was done at the Royal Society of Medicine in London. How times have changed since then. First of all, how have you been coping with it all? Because obviously for you, it's not just the worry of everything that's going on, but obviously you're on the front line.
It's been a fascinating time. I mean, fascinating in terms of my professional life. So as a GP, I know that how many patients are touched by coronavirus in some form or another. People are worried about it, so it's causing a lot of anxiety. People are getting quite down about it as well. And it's changing people's lives, and people are worried about their futures. On the other hand, on TV, I've been covering the rapidly changing news on a daily basis from the beginning of the year. So it's been an enormous challenge professionally, which I suppose is a distraction. Most people, their lives are independent of caring for people with COVID or talking about COVID. They're across what they hear on the news, and they're trying to make sense of it. But my job is to try and give a sensible perspective on the pandemic, to give people sound advice, to give people some direction and reassurance, if you like, but also to tell them how important it is to not be complacent and not take this too lightly. So, yeah, I've had the distraction of working through the pandemic, which has been interesting and professionally challenging. But of course, I am concerned about my family and my friends, just like everybody else.
I mean, that's the thing I've done many interviews over the past couple of months with people, and a lot of them are obviously in the entertainment industry, and their work has dried up. I mean, singers, actors, performers, presenters, their work has dried up. Whereas for you, it's a completely different story, because for you, work has gone through the roof, and obviously it's such a high pressure job. Like many people on the front line, you are kind of like the heroes saving the day, and it must be quite a stressful job to do, but also it must be quite hard work, wondering when will I get a break?
Well, the news changes all the time. So what I report in the morning on Good Morning Britain, for example, or on Steve Wright's show, might be changing by the evening. So I keep across all the reams of evidence and research that keeps coming in, and I try to edit that down to make some sense of it for the general public. So yes, it is arduous, but it's something that I think doctors rise to when there's a need to rise to a challenge. You just get on and do it, and it's very important. I would say that it's stimulating, certainly, but it's important too to get this right. We're going to be living with the virus for some time, and I think the way out of this pandemic is for everybody to pull together, to socially behave in a way that is responsible for everybody. And different age groups have their different pressures on them. But at the end of the day, we want to keep as many people safe as possible and keep the NHS working efficiently.
I mean, obviously everyone's, doing their bit, obviously with washing hands and keeping the distance. I mean, for you, when you're, out and about, doing obviously everything you can on the front line, do you ever get to the point where you sort of think that people are getting the message, or do you think there are still a lot of people out there that maybe aren't quite understanding what's going on and aren't really sort of doing what they can to help out?
It's definitely a bit of both. There are a lot of people being very sensible. They're wearing their masks in the correct way and at the right times. They're socially distancing. They are aware of the dangers and the risks. There are other people who are completely in denial about this virus. They don't think it'll affect them. So the people that they know, they will hug and embrace without a second thought. So they might adhere to the rules in one area and completely ignore them in another. And, we've seen high profile people do this. We've seen a number of high profile people who should know better flout the rules and think, the rules apply to other people. And it's an interesting look at human behavior and psychology, if you like, why people would behave like that if they think they're above the law or above the guidelines, that it won't happen to them. So, there'll be people writing books about this right now. But I feel sorry for those people who are in entertainment, artists. I mean, we need music, we need theatre, we need all those things. But of course, we can't have audiences at the moment. At the time of recording this, we can't have people in close proximity indoors. So at least we have some history. We've got recordings. We've got some beautiful stuff. But a lot of people haven't had time to play the music that they want to hear, or read the books they want to read, or see recordings of shows that they want to see. So we've got to catch up with what we've been doing and hope that in a short period of time we can get back to new stuff and new creativity, which will cheer us all up.
I know that people are sort of experimenting in many different ways, and we've had Andrew Lloyd Webber has been experimenting with socially distanced audiences. He had Beverly Knight was doing a performance, and obviously the audience was, few and far between. Obviously, everyone doing their distance. It shows that it can be done, but I think there is that risk because obviously, first of all, can a theatre really survive with a minuscule audience, but also is it safe for the people in the audience, because there's still that risk.
Yeah, that's right. I mean, what we know is that the further apart people are, the lower the risk of the virus being transmitted. Having said that, different people have different ideas about what the social distance should be. You can't just reduce it, because the economy is suffering. If a safe distance is 2 meters, you reduce it to 1 meter, you're going to increase the transmission rate. However, you've got the paradox, for a theatre to be alive, to be really alive, people need to be crowded together. We need to react with the person next to us and in front of us. And you see people standing up for the encore and the ovation. And it's not the same, whether it's a football stadium or a West End theatre, it's not the same. But look, I think the way we have to see it, as far as I'm concerned, is this is a once in 100-year pandemic. We have to acknowledge that we're in a situation akin to the kind of situation we were in 1914 and 1939 with the outbreak of 2 horrible world wars. It affected our lives, and it affected our lives for many, many years, probably far longer than this pandemic will. So, this is the first challenge this generation has ever had of this nature, of this magnitude. So we have to get that into perspective. We have to say, right, it's here. We have to deal with it. We have to man up. We have to deal with it, and we'll get through it.
I mean, the thing that a lot of people have been saying, and I do agree with this, is that obviously I think it's a lot easier for us now compared to obviously, people that were going through the war, because we've got so much more to keep us occupied, to keep us entertained. I mean, obviously things like Netflix, like you say, music, books, all of this, we've got that kind of form of entertainment. Whereas obviously, back when people were going through the war and everything, they didn't have anywhere near as much entertainment as we do now.
That's right. I mean, we almost certainly have taken so many things for granted. And, when so many of those things are withdrawn all at once, it's a big shock. However, we still have communication like this. We still have radio, we still have television and multiple channels. We have the internet, we have books, we have friends that we can contact straight away. In the past, it would take days for news to filter through. Now we know what's going on 5 minutes before. So we should be still grateful for what we have. We have enough. We don't have rationing that they had during the wars. Our immediate lives aren't at random danger from a bomb falling out of the sky, and therefore we have to be strong. We have to be resilient, but we can all do our bit to mitigate these circumstances, and we can help the NHS, and we can make sure that we don't stampede for toilet rolls and stupid behaviour like that, and we'll get through it.
Because obviously the other thing that's coming up very soon is the kids will be going back to school in September. Obviously, there's a lot of debate at the moment whether kids should be wearing masks at school or whether they shouldn't. I mean, what do you think about all of that?
Well, wearing masks, I think, is beneficial. Generally speaking, we know that it helps to reduce transmission from somebody who's carrying COVID-19. So if that person, even if they've got no symptoms, has got COVID-19, then them wearing a mask does reduce the risk of the virus being transmitted to other people. So it seems respectful to wear a mask for that reason. It also seems logical because it reminds people that there is something going on, and that it reminds them to wash their hands and to socially distance and to behave responsibly. In terms of schools, we know that adults are on public transport and going into shops and supermarkets and cinemas, theatres, when they're open, have to wear masks. It's mandatory to wear masks because we think there is a marginal benefit. Now, children too, aged 12 and over, have to wear masks in those situations. But currently, the advice is that they don't have to wear masks in England in schools, because the thinking is that they are not meeting strangers in shops and in supermarkets. They are in the classroom with the same people that they see on a daily basis. That is their social bubble. It's a bigger bubble than the household, but nevertheless, it's the same people. And the thinking is that children are very rarely affected by COVID-19 and probably don't transmit it so much. That is the evidence that we have. And because masks can reduce the communication between teacher and pupil, can mask, hide facial expression, can muffle speech, the thinking is that the marginal benefit is outweighed by better communication skills and being free in the classroom bubble. If you're going down a busy corridor at school, mixing with other classes, then fine, put the mask on. So my way of thinking is that compromise, that it's not mandatory, except when you come out of your little classroom bubble and the rest of the school is around you.
Now, I know with obviously, some people have said that wearing masks can restrict your, breathing, which, I mean, I've seen videos online of, it was a doctor who put about 7 or 8 masks on, proved that his heart rate, his breathing wasn't affected at all. So do you think it is trying to get that message out there that as long as you breathe normally and you keep calm, that a face mask won't affect you at all?
Yeah, I think it's a psychological handicap. You put anything over your mouth and nose and people feel like they're suffocating. They feel a bit claustrophobic, a bit like being dunked underwater at the swimming pool or breathing through a snorkel. You think, oh, this is different. This is a different sensation. And it's easy to feel a little bit anxious or panicked about that. So I get that. And it's that the doctor's experiment is quite right, that actually the amount of air going in and out of your lungs, even with a mask on, is exactly the same whether you've got a mask on or not. There's no reason why it should make asthma worse. Asthma is an allergic reaction in the airways to something like cold weather, cold air that you're breathing, or a viral infection, or some sort of allergic pollen that you're breathing in. A mask isn't causing any of those things, so it shouldn't affect people with asthma, and I'm not convinced it would affect anybody with chronic pulmonary airways disease. But if they feel a bit panicky and anxious, then probably wear it for a couple of minutes, take it off, and then next time wear it for a bit longer. Get used to it. Most people will get used to masks. I mean, in hospitals, nurses and doctors have been wearing masks for 12 hours a day, plus a visor, plus an apron. And they just get on and do it. They don't make a fuss. They know it's important. So I think we all owe it to doctors and nurses to try to emulate their example.
And obviously, a few weeks ago, we had that really hot weather. So I imagine that for you as doctors and nurses and anyone within a hospital wearing all that PPE must have been really hard work.
Oh, immensely. I mean, I speak to my colleagues on the front line, and they were really distressed sometimes. I mean, they're perspiring. They feel hot and bothered. It's uncomfortable. They feel sticky. They're trying to work with sometimes very sick patients. but they can take short breaks, but they still have to get back into the thick of it. And I take my hat off to them. They've done a fantastic job and are still doing a fantastic job. And PPE, there's no easy way around it. There's no comfortable PPE, but it does protect people.
Now, obviously, throughout the whole pandemic, the nation have been worried and scared, not kind of knowing what's coming around the corner. And I think one thing that a lot of people have found comforting was obviously having people like yourself and Lorraine Kelly on the telly every morning, kind of, feeding us the news that we need and kind of putting it in a way that's not scary, that's not too, over the top. It's just a nice, easy way of helping people to understand what's going on.
Yeah, well, I'm a human being like everybody else. So I just try and express the way I think about things as I would to a member of my family or a friend. I try to give them the facts and neither be alarmist nor too reassuring. The truth is that the virus is a very virulent virus. It's a very contagious virus. It seems to be resurging again. We never really got through the first wave, and many countries are now experiencing a resurgence of the coronavirus because we came out of lockdown. There's a lot of people carrying on as if nothing's happened. They want to fly away on holiday. They want to go and see other members of their family outside the initial immediate household. And, as I say, when people are together, that's how the virus is transmitted. We don't know if people develop antibodies or how long they last. We don't know if a vaccine will be safe and effective or how soon it'll be produced and how long lasting it will be and whether it's effective in every age group. There are so many unknowns. All we can do is report on what we do know and to make as many guidelines as we can that keep as many people as possible safe. And then life will go ahead in the future, I have no doubt.
I mean, do you think that there will be another peak, or is it too early to say at the moment, do you think?
No, I think there will be because we've got more cases now. We've got areas, local areas where there's been a big spike in cases, and that could happen anywhere in the country, potentially. We're seeing cases rise in Spain, in certain areas of France, in the Netherlands, Croatia and Switzerland. And of course in India and South America, it's a global pandemic. So yeah, I think we will see a rise in cases, and at some point we'll have to say, whoa, we've got to control this again. And that will mean putting in place some more restrictions. But that's the way we're going to control this, and it will all depend on the amount of hospitalization, admissions and mortality rates.
I mean, obviously, I know a lot of people are talking about Christmas, which seems so far away at the moment. But no one knows. I mean, could we end up in a lockdown over Christmas?
Yeah, it's possible. Some doctors and scientists are concerned about the seasonal flu on top of COVID-19. So if COVID-19 cases are rising again, it would be a double whammy if seasonal flu arrived. A completely different virus. We normally see a rise in seasonal flu cases in the winter, and that means more people will be coughing and spluttering and potentially transmitting both seasonal flu and COVID-19 if they're carrying it to other people. Having said that, if people are socially distancing, wearing masks and washing hands, we should see less seasonal flu. That's what we would hope to see. That's the logical expectation. But a lot of this remains to be seen. When winter comes, people flock together. They go indoors more. And we know that being outdoors is relatively protective against COVID-19. So there are many factors that we need to consider. And we can still enjoy Christmas, even if it's just the immediate household, even if we can't visit as many people as we want to or have guests at home. We might have to say that this Christmas is, a different one to the one we normally have.
I mean, I know that obviously, we've been quite lucky with the weather over the past couple of months in that we've had a fair bit of nice weather. Maybe it's on the turn. I'm fingers crossed it isn't quite just yet. But obviously, things like Zoom and doing things, a bit differently, like you say, there's nothing wrong with, having a family Zoom call for Christmas, or, if it needs to be done that way, it's got to be done that way.
Absolutely, and there's always I always like to find positives in situations, and there's no doubt that some people have said, look, there are positives to come out of the circumstances we're currently in. People have rediscovered board games that they haven't played for years. They've rediscovered the joy of reading. They've rediscovered joys of spending time outdoors and in the garden. Of exercising more, of experimenting in the kitchen with new dishes. There are lots of things that people have really enjoyed doing, and just spending more time together as a family. That's one of the things that I hear all the time, that they've enjoyed sitting down for a meal together, which they haven't been doing for a long time. They've enjoyed not commuting and the rush hour. So I think we need to hang on to those positives as well as worry about the negatives.
I mean, have you had chance to have a bit of a break at all recently? Have you had chance to kind of, recharge your batteries, really?
Yeah, I had a 3 or 4 weeks off through the summer, which was nice. It meant that I could just, like everybody needs to, just switch off the news when it becomes all-encompassing. Just switch it off and get out there in the fresh air, look at the clouds, look at the sky, be at one with nature a little bit, get some exercise. Just walk away from it. When everything gets a bit too much, you just need to walk away and get some peace and quiet. And most people can do that, and that's what I did. I had a little break. I tried to just read other things than COVID-19. I kept one eye on it, obviously, and my ear to the ground, but I wasn't focused on it sort of 16 hours a day. So I had a nice break, and everybody needs to have that from time to time.
I mean, I was going to say, the NHS are an amazing organisation, and we should be so thankful and lucky that we have them. I mean, obviously, we talked about it last year when we did our Take 5 show, but I think now more than ever, I think people are really saying thank you to the NHS, and they need a break. They deserve it.
They really do. I mean, they did an extraordinary job. They are doing an extraordinary job. What's happened is that the focus has moved from the amazing job the NHS did at the beginning of the pandemic to how this affects people's lives at home. So the pictures we saw in the early days that frightened people in intensive care units where there weren't enough ventilators, people were being nursed on their fronts, people were dying in relatively large numbers. That was shocking, and everybody became very scared. That's kind of, the media coverage has changed. So we're talking about how it affects people's lives and the little inconveniences that this pandemic is causing. But the work of the NHS goes on in the background, day in, day out, night and day. A lot of NHS staff lost their lives in the early stages of the pandemic, and people clapped on their doorsteps on a Thursday night, and that was wonderful. But it upset some doctors because the behaviour of some people didn't reflect the appreciation of the majority. So they thought, why are we putting our lives on the line when some people aren't that bothered about changing their behaviour? And one can understand that sort of bitterness, but they kept going anyway. That's their duty, and that's their vocation, and that's what they do. The problem now is that the NHS staff are fatigued. They need a break, but they can't have one as much as they deserve. And when we see more cases again, plus seasonal flu threatening us as the winter approaches, plus the enormous backlog of diagnostic tests that need to be done and treatments for heart disease and cancer, it's an uphill struggle. It's like Sisyphus trying to push that stone up the hill, and it keeps rolling down again. And you can't produce more doctors in the blink of an eye. So the same doctors, the same nurses are struggling to cope, and they're heroic. I really am pleased to be part of the medical and nursing profession that has done such a marvellous job.
I mean, everyone said it, and I completely agree. I think we're lucky. We do have one of the greatest national health services in the world.
Absolutely. You've only got to look at pictures coming from other parts of the world to see how lucky we are. Everyone is treated the same, no matter what their means, no matter what their religion, no matter what their beliefs, their colour, they're treated as one. We're all equal in the eyes of the NHS, and that's one of the redeeming features. And it does a remarkable job. It has been under-resourced and underappreciated until recently. It is now very appreciated. It's still under-resourced, and hopefully this will, in years to come, put it right. But I don't hold my breath, because normally when we get through these crises, everything goes back to normal. But hopefully it will change. What's good is that there's been massive interest in people wanting to become nurses or doctors. They see this as this is an important job. This is a job that changes people's lives, saves people's lives, makes a difference. So I think, it's very encouraging that people say, I'd like to do that. That's an amazing job, and I'd like to do that.
Now, I just want to say it's been an absolute pleasure talking to you. I could continue for hours. But just before we go, have you got any messages for anyone who is currently stuck in hospital at the moment, obviously wanting to get out back into sort of a bit more normality? Any messages for them?
Of course. I've been a patient myself over the years, and doctors make the worst patients. We are awful patients. We moan. We're difficult to put up with because we know I suppose a little bit of knowledge is a dangerous thing. But, if you're in hospital now, just be aware that you are in a marvellous institution. You're in safe hands. And it's a wonderful service that you'll get, first class NHS treatment. And spare a thought for the hardworking nurses. They're human beings as well. Treat them well. Make sure that you ask how they are. And when the doctors come along, understand that they're busy. But if you have questions to ask, don't be afraid to ask them. And hopefully, when you are better and you've been discharged and you've gone home, you won't forget them, and you'll do your little bit, whether it's volunteering or some charity work, to support your local hospital.
Thank you so much, Dr. Hilary. It's been an absolute pleasure. Of course, keep safe, and thank you again for your time.
Matthew, thank you.